Hello everyone, and thanks for joining us today. This is an introduction to the Mid-America Prevention Technology Transfer Center. Before we get into the content, we'd like to thank our funders, the Substance Abuse and Mental Health Services Administration, oftenly referred to as SAMHSA. And a quick note, although funded by SAMHSA, the content of this recording does not necessarily reflect the views or opinions of SAMHSA or of HHS. I'm your speaker today, Dave Clausen, and I'm the director of the Mid-America Prevention Technology Transfer Center, and I'm really looking forward to working with all of you over the coming years. I wanted to take a moment to just share a little bit about my background for those of you who I haven't had the chance to work with yet. I previously worked as a TTA specialist for SAMHSA's Center for the Application of Prevention Technologies, or the CAPT. Now, there I had the opportunity to provide training and TA to states, tribes, communities, and universities across the country. Now, I thoroughly enjoyed my time as a coach for the CAPT's Coaching for Success initiative. There, I worked with high-need clients to develop and deliver customized training and TA plan using a comprehensive approach that really focused on building their capacity to implement evidence-based prevention strategies. Before joining the CAPT, I was the Assistant Director of the Illinois Higher Education Center for Alcohol, Other Drug, and Violence Prevention. There, we assisted Illinois colleges and universities in reducing the negative alcohol and other drug consequences impeding student academic success, personal growth, and their development. Now, I like to say that I bring a unique experience to prevention, having served as a campus police officer at Eastern Illinois University. There, I had the opportunity to serve as a crime prevention officer. And through my crime prevention programming, I'd worked with students, faculty, and staff on topics ranging from bystander intervention, substance misuse prevention, and motivational interviewing. And through my going out and engaging with departments across campus and members of the community, that's really where I got my start in prevention work. And this is also where the concept for my book, Motivational Interviewing for Campus Police, was born. And then lastly, I'm proud to say that I'm a veteran of the Illinois Army National Guard and was deployed to Iraq in 2005. And coming with my military background, I'm really looking forward to collaborating and working with the National Guard counter-drug teams. Whether it's from my military or law enforcement background, I still always like to know where I'm going. So here's where we're going today. First, going to break down the technology transfer system. A slightly different approach to TA than the previous CAPT model. Then I'll run through the big picture view of the TTC network. And then lastly, we'll take a deeper dive into who we are, the Mid-America PTTC, and how we can serve you. Just 3 simple content sections, simple, short, and concise, as I want to respect your valuable time, and I know we all stay very busy. As many of you know, SAMHSA has changed their TA model from the National Center for the Application of Prevention Technologies to the more regionally based Technology Transfer Center model. Now, this model creates a network of TTCs which focus on prevention, mental health, and addiction. Now, previously through the contractor or CAPT model, TA grantees had to request TA from the CAPT. Now, with this new model, we have a cooperative agreement and we're responsible for executing our pre-approved work plans that we submitted to SAMHSA. Now, moving forward, you won't need to request TA, but instead, you'll be able to access TA from our existing work and from our planned work. Now, throughout the TTC network, the training and the TA is already there for you to access. Now, you'll hear these referred to as the PTTC for prevention, the MHTTC for mental health, and then the ATTC for addiction. Both the prevention and the mental health TTCs are the newest addition to the network, as the ATTCs were established back in 1993. The technology transfer system is essentially designed to accelerate the diffusion of an innovation. Now, technology transfer begins during the development of a new technology, and it continues through its dissemination and extends into early implementation. Now, this process requires multiple stakeholders and resources and involves activities related to translation and adoption of that technology. And a quick fun fact, the technology transfer model actually started right here in our region at Iowa State University in the early 1930s. And it's also been used in the ATTC network for over 25 years. Back to that definition. It's designed to accelerate the diffusion of an innovation. Well, innovation is where research meets practical. It's a new idea, technology, or method. Essentially an evidence-based strategy or practice. And in the development, when it comes to technology transfer systems, that's creating and initially evaluating one of those new innovations. Now think, the NIH or NIAAA coming out with the evidence-based strategies, the research, telling us what really does work. And when it comes to translation, that's how we apply that new innovation in a real-world setting, explaining the essential elements and the relevance, and packing it to facilitate dissemination through webinars, toolkits, trainings, podcasts, or newsletters. That's something we will do here at our TTC. And then dissemination is marketing, conferences, podcasts, those listservs. It's essentially promoting the awareness of that new innovation and encouraging adoption and implementation. Really just raising awareness, building knowledge, and distributing those materials. And then adoption is finding the right fit, deciding whether to use an innovation or not. Now, adoption may or may not lead to implementation. It's like taking things for a test drive before actually buying. And then lastly, you have implementation, and that's incorporating that new innovation into your routine practice through a comprehensive approach of skill building, increasing buy-in from administration or stakeholders, policy change. Think the SPIF or SAPs or motivational interviewing, for example. Now, dissemination doesn't equal or guarantee implementation. And implementation can take 1 to 4 years. And training alone is not enough. And that last little part, diffusion, that encompasses dissemination, adoption, and implementation, this can be planned or spontaneous. It's the spread of an innovation, creating that movement, that momentum, compared to going viral, becoming a norm, a normal practice. Here's a map of the PTTC network. A quick reminder, the MHTTC network and the ATTC network all have regional centers and national coordinating offices just as the PTTC network. But our network is comprised of the National Coordinating Office, National American Indian and Alaska Native PTTC, National Hispanic and Latino PTTC, along with 10 regional TTCs. Now the National Network Office, they're going to respond to SAMHSA. They're going to facilitate network-wide work groups and collaborative products. They'll help develop those national products. And they're going to partner with national organizations and really focus on common network priority areas. And for those 10 regional TTCs, we'll focus primarily on frontline practitioners, provide education, training, and TA, develop region-specific products, and utilize regional advisory boards. Then we'll also respond to the needs of regional stakeholders. Now, if you're interested in connecting with your ATTC or MHTTC or any of the national centers, just drop me an email and I'll gladly connect you to them. Now that we've gone through the big picture view, let's dive deeper into the Mid-America PTTC and talk about how we will serve you, the states and clients and community members in our region. As I mentioned earlier, the TTCs are operating on a cooperative agreement with SAMHSA. And for the Mid-America PTTC, that agreement is with ACT Missouri. And I wanted to provide a little background on who ACT Missouri is and what they do. Now, they are a private, not-for-profit corporation that was established in 1991 to promote drug and alcohol awareness throughout Missouri. They've got over 25 years of experience providing training in TA and support throughout Missouri. And they work with community groups across the state to really spread the message about making healthy choices. And they partner with national organizations like SAD, the Partnership for Drug-Free Kids. And they're funded through the Missouri Department of Mental Health. They've also got a network of regional support centers and community coalitions that they support. And they function as a communication hub to help disseminate the best practices and evidence-based strategies and training in TA that's available to their communities. They also collaborate with other statewide agencies like the Missouri Pharmacy Association, the Missouri Alliance for Drug Endangered Children, the Missouri Department of Transportation, and the Missouri Juvenile Justice Association. And they've got over 10 regional prevention resource centers that serve a network of over 120 community coalitions. The Mid-America Prevention Technology Transfer Center is designed to serve as a prevention catalyst, empowering individuals and fostering partnerships to promote safe, healthy, and drug-free communities across Missouri, Iowa, Nebraska, and Kansas. Now, our services are evidence-based, culturally competent, and locally focused. We'll provide intensive technical assistance to support organizations and systems efforts to implement evidence-based prevention strategies. Now, we'll also form partnerships with local and regional stakeholders to ensure that the training needs of the region are identified and met. Now, some of our goals are to really accelerate that adoption and implementation of evidence-based and promising substance misuse prevention strategies. We'll work to heighten the awareness, knowledge, and skills of the workforce that address substance misuse prevention, and foster regional and national alliances among culturally diverse practitioners, researchers, policymakers, funders, and the local communities. We've got a regional advisory board comprised of prevention stakeholders and leaders from all 4 of our states as well, and we'll be meeting quarterly to really ensure that the training needs for our region are identified and met. As I stated earlier, we'll be focusing primarily on frontline practitioners, providing education, training, and TA, and then developing region-specific products. Now, just a few examples of some of our services would be the substance abuse prevention skills training, both the actual training and the training of trainers, prevention ethics and prevention ethics training of trainers, the core drug endangered children training, and training on the strategic prevention framework. Now, those are just a few examples, not a comprehensive list. We'll also be developing and delivering webinars, creating some virtual learning communities and a peer sharing network, a regional podcast, and a newsletter filled with resources, case studies, and our upcoming TA services. Now, the best place to start in order to access our training and TA services would be our website, which is pictured here, the pttcnetwork.org/pttc-MA for Mid-America. There, you'll be able to see all of our upcoming services, training, TA, those regional products that we're going to create. You'll be able to subscribe to our newsletter and our listserv, and access our podcasts there as well. We're also available via email and phone, and that contact information is both located at the end of this recording and on our website. Either way, reach out because we're always here to help. To be best connected with you, I wanted to share my personal email address, and it is dclosson@actmissouri.org. Feel free to send an email with any requests for training or TA services, any questions, or if there's any way I can help you out or connect you to some resources that you need. Thank you again for your time today, and look forward to working with you throughout the next few years.